To a parent, one of the worst feelings in the world is seeing your child in pain. But what would you do if your child was in such agonizing pain to the point that your only option to be able to provide them with treatment would also increase their risk of cancer? Would you be willing to trade one awful disease in exchange for the increased risk of acquiring another one? That is the greatest question surrounding the use of the medication Remicade for the treatment of Crohn's disease in children. Though presented with the possible side effect of acquiring non-Hodgkin's lymphoma, the FDA does state, however, that the controversial drug is more beneficial in the long-term treatment of Crohn's disease in children as opposed to the surgical removal of their diseased bowels. Crohn's disease is a type of irritable bowel disorder, also known as an IBD, characterized by thickening of the intestinal wall and inflammation anywhere in the GI tract from the mouth to the anus. Unlike other forms of IBD, such as ulcerative colitis, that have consistent inflammation throughout the intestines, the Crohn's and Colitis Foundation of America states that in Crohn's disease, the inflammation of the intestines can skip, leaving normal healthy areas in between patches of diseased intestine. Now, the GI tract of a normal healthy child contains in it many types of harmless bacteria that aid in the digestion of food. The immune system of a normal healthy child recognizes that these bacteria are not foreign to the body and in turn do not attack them. In the body of a child suffering from Crohn's disease, however, the bacteria in their GI tract are mistaken as harmful intruders and the immune system responds by attacking. Symptoms of Crohn's disease can include abdominal pain, cramping, and general discomfort, in addition to fatigue, fever, chills, persistent diarrhea, vomiting, bloody stool, and rapid weight loss. Once these symptoms begin, it is highly important to begin a course of treatment to avoid any permanent damage done to your child's body. In the most severe cases of Crohn's disease, the young patients and their families are faced with the harsh decision of having to decide between having a bowel resection or using more extreme, controversial medications. A bowel resection is an elaborate procedure that involves the surgical removal of the diseased intestines of your child. Once removed, a stoma is created through their abdominal wall and they are left with an ileostomy and a waste bag for elimination. The last step in treatment before opting for this harsh surgical procedure is the introduction of the Remicade infusion. The Remicade infusion is highly controversial because, as I've stated before, this medication can lead to the young patient acquiring non-Hodgkin's lymphoma, a rare and aggressive form of cancer affecting the bloodstream. So a lot of people might be asking, why take the risk? Why would you go this route for treatment when there all are alternatives? Why would someone even consider risking their child's health? And I have to tell you, Crohn's disease is a terrible disease. Many people think of it as an issue just affecting the stomach, just a little bit of belly pain, but in actuality, Crohn's disease is a terrible autoimmune disorder that affects the entire body system as a whole. And with physical ailments come emotional ailments as well. Regarding Crohn's disease in adolescents, pediatric gastroenterologist Dr. Andrew B. Grossman has stated, while Crohn's disease causes many problems for people of all ages, it can present special challenges for children and teens. In addition to bothersome and often painful symptoms, the disease can stunt growth, delay puberty, and weaken the bones. Crohn's disease symptoms may sometimes prevent a child from participating in enjoyable activities. The emotional and psychological issues of living with Crohn's disease can be especially difficult for young people. So with the onset of Crohn's disease typically developing between the ages of 13 and 19, more and more youths all over the world every day are suffering from this disease. And once your child gets to a point where they are too sick for any other forms of treatment, Remicade might be their only option anyway. And it might even be their last option. Why would you want them to get to that point? Why would you want them to get so sick that they had no other treatment options? You can decide to treat your child's disease before it gets too far. As I've stated before, Remicade is a highly controversial drug. It is a man-made antibody developed in mice, yes, mice, due to their proteins being able to create reactions in our human bodies. Possible side effects of Remicade include infection, liver disease, vitiligo, lupus, and in the most severe reactions, non-Hodgkin's lymphoma. Due to the controversial nature of the drug, prior to beginning treatment, a thorough exam is performed on your child by their physician. Your child will be tested for hepatitis B and tuberculosis, as Remicade can reactivate these conditions. Once medically cleared, the Remicade treatment is infused to your child through an intravenous catheter in their arm for a period of 2 hours for between 6 to 8 weekly sessions. Following the completion of this series of infusions, it is expected that your child will be in total relief of their flare-ups and be considered in remission. Though minimal, the risk of cancer does exist, making it a difficult choice for children and their parents as a course of treatment. Studies done by the FDA have stated that because of its effectiveness in introducing disease remission, Remicade is used increasingly as a maintenance medication for the treatment of pediatric IBD. 79% of patients who received Remicade demonstrated dramatic anti-inflammatory symptoms and increased quality of life effects as measured from the time of first treatment. So these studies have proven that there has been an increase of quality of life for sufferers of Crohn's over time with the treatment of the Remicade versus the patients who have opted for the surgical treatment and the ileostomy bag. And in regards to the ileostomy bag, it is a huge dissatisfier in children. Many young patients have reported poor body image, anxiety, and depression following their ostomy procedures. And in addition to all that, which is very stressful, surgery is not a cure. While the bowel resection may result in the relief of your child's symptoms from their Crohn's disease, they are not considered in remission, and I have to reiterate, it is not a cure. Their Crohn's can come back at any time. And actually, the FDA does state in regards to flares that approximately 30% of patients who have surgery for Crohn's disease experience recurrence of their symptoms within 3 years, and up to 60% will have recurrence within 10. Crohn's disease is a terrible illness that not only leaves its sufferers feeling sick and weak, but it also affects the patient's ability to lead a full and active life. The obvious question for sufferers in this position is there too high a price to pay to be pain-free? Though presented with the possible side effect of lymphoma, the controversial medication Remicade is actually more beneficial in the treatment of Crohn's disease in regards to remission. With the success rate of remission being so high with Crohn's, it is a good first option for treatment. If the patient immediately opts for their bowel resection and they lose the majority of their intestines, they have to understand that once their disease flares up, surgery is not a repeatable course of treatment for them. However, with the Remicade infusion, the patient has the ability to continue the course of maintenance treatment as needed. This also leaves the bowel resection surgery as a viable option for later in life, should they continue to see no relief for their symptoms. Data from many studies provide evidence that, though controversial, many patients, adolescent through adult, have found relief and a better quality of life through treatments with Remicade. So I have to ask you again, is there too high a price to pay for a lifetime of being pain-free? Thank you.